Hello friends, so this video is the continuation of corneal transplantation series that I started where last time I discussed with you all about penetrating keratoplasty. So today I will discuss with you all about deep anterior lamellar keratoplasty or in short DALK. Okay, so what is DALK? So deep anterior lamellar keratoplasty is a surgical procedure which is used to replace the anterior layer of the cornea while preserving the patient healthy endothelium, which is the innermost layer of the cornea. So unlike penetrating keratoplasty, which involve replacing the entire thickness of the cornea, DALK or deep anterior lamellar keratoplasty selectively remove and replace the front layer of the cornea, leaving the healthy endothelium intact. So this technique is particularly useful in conditions like keratoconus or corneal dystrophies. Okay, so penetrating keratoplasty is an effective way to restore the vision in many cases, but in some cases, disadvantages are also there for penetrating keratoplasty. So, because it breaches the structural and immunological integrity of the eye, which can result in traumatic wound, dehiscence, and endothelium graft rejection. So, in this kind of cases, this DELK it really comes to play. So these are the indication for DELK where first of all keratoconus. So when I say about keratoconus, then you may say that penetrating keratoplasty will be better option than DELK. So it's quite controversial where if you see that the patient is having healthy endothelial layer, then consultant may mostly prefer to go for DELK to give the cornea an additional strength. But if you see that the cornea is having acute eye drop with endothelial layer damage, then PK or penetrating keratoplasty can be a good option. But in the last video, you have seen that keratoconus case fall under category 1, where the success rate of the surgery is more than 90%. So it mostly depends on the consultant also. So here, next, pellucid marginal degeneration. So as you know that pellucid marginal degeneration causes thinning in inferior to the cornea. So in severe cases where contact lens also can't help, then so in that case, PK cannot be a good option as the peripheral thinning is there and there will be a high chance of graft rejection in PK. So in this type of cases, DALK or decimate deep interlamellar keratoplasty can be an effective way to save the eye, which give an advantage of both PK and lamellar keratoplasty as well. So here, this is hereditary stromal dystrophy. So dystrophies are inherited corneal deposit where it lead to opacification of the eye. So in this kind of cases, DELK are preferred choice to remove the opacity like granular dystrophy or lattice dystrophy. But DELK is not a good option for macular dystrophy because it invade to deeper stromal layer as well as sometimes it also reach to decimate membrane. So even after you do DELK in this patient who are having macular dystrophy, then also vision is not that much improved because of the scar formation. So whenever you get a patient having corneal dystrophy, then definitely you should send the patient for ASOCT for the examination that how much deep layer or the opacity has reached so that you can select the suitable corneal transplantation option to give the patient good surgical outcome. Okay. Then corneal stromal scar. So in case of corneal stromal scar, if the decimate membrane is paired, then you can plan for DELK. So ultimately, the point of view is that the endothelium layer and the decimate membrane is healthy. Then why to remove them and remove the affected layer so that the chances of graft rejection will be reduced here. And in case of infectious keratitis, so if you see the cornea having an active infection, then you cannot plan any transplantation surgery. So if the patient infection is active, then treat it well. And after that, when the keratitis is healed, um, but after that, after healing, the keratitis healing, it lead to corneal scar formation. So that corneal scar that hampering the vision of the patient, then definitely you should go for corneal transplantation. So here these are the contraindication for decimate stripping endothelium keratoplasty, where any endothelium damage to the disorder or any deep corneal scar extending to decimate membrane. So in this kind of patient, if you perform DALK, then also you will not get that much good outcome. So how this surgery is actually performed? So first of all, preparation is with any surgical procedure, the patient should undergo a thorough preoperative evaluation to assess the condition of the cornea and overall eye health. So the donor cornea is also carefully screened and prepared. Then anesthesia. So local or general anesthesia administered to ensure the patient comfort during the procedure, and then partial thickness corneal dissection. So using a microkeratome manual dissection technique, the surgeon create a partial thickness dissection within the cornea, typically reaching to the level of decimate membrane. So this dissection separates the anterior layer of the cornea from the deeper layers, and including the healthy endothelium. Then after that, removal of the diseased tissue. So here, surgeon carefully remove the diseased scar tissue from the anterior portion of the cornea, leaving the healthy endothelium and deeper layer intact. So specialized techniques and instrument may be used to ensure the precise and controlled tissue removal here. After that, this donor tissue is preparation is there. So the donor tissue is also prepared by removing the anterior layer while leaving the endothelium and decimate membrane intact. So the size and thickness of the donor tissue are matched to the recipient cornea. So after that, graft placement. So here the prepared donor tissue is transplanted into the recipient cornea carefully position over the disease area. So the graft is secured in place using air or fluid pressure. So without the need for sutures in many cases. So that interface between the recipient and donor tissue is meticulously inspected to ensure the proper alignment and adhesion also. So after that, the surgical site is inspected for any leak or irregularities, and the eye may be paired to protect it during the initial healing period. So patients are prescribed medication to prevent infections or also to reduce the inflammation and also promote healing. So regular follow-up visits are scheduled to monitor the process of healing and assess the visual outcome of this TELC procedure. So DELK actually offers several advantages over penetrating keratoplasty, which include risk of endothelial rejection and improved long-term graft survival. So by preserving the patient endothelium, DELK also eliminate the need for long-term immunosuppressive medication, which are typically required after penetrating keratoplasty. So, however, DELK can be technically challenging and may require specialist training and expertise to achieve optimal result here. So that's all friends. Thanks for watching. Please don't forget to like and subscribe to my channel. I hope this video helped you a lot and to understand